My name is Cassie Kleppel, and today is January 29th, and I'm doing my trach suction and dressing change. And it's my last semester. Knock, knock, knock. Hi, Mr. Jones. My name is Cassie. I'm going to be your nurse today. Can you tell me your name and date of birth? Perfect. I'm just going to provide some privacy because your respiratory status isn't doing as well as we'd like, and we can kind of hear some secretions you're not able to get out. So I'm going to do a suctioning in your trach, and then we're also going to change the dressing while we're doing that, okay? So first I'm going to put this towel under, and then I'm going to go ahead and pre-oxygenate my patient. I'm going to turn my suction on between 80 and 120. If my glove rolled at the bottom, I would get a new sterile glove. And then I'm gonna kind of coil my suction into my hand, and then I'm gonna measure. I'm gonna measure from the tip of the nose to the earlobe, and then down to the sternum. Make sure I don't actually touch the patient and keep it sterile. So I make this number in my head. And then I'm going to contaminate my other hand. Okay. Now I'm going to test my suction. That's good. So on the count of 3, I'm going to insert the suction. Just take a nice deep breath. And I'll insert it to where my line was without suctioning. And then once I'm down, I'm going to intermittently suction and twist on my way out. And then I will oxygenate the patient again. I would make sure I let him rest at least 30 seconds to 60 seconds between each pass. And I would only be in there suctioning for about 10 to 15 seconds. I would never do more than 3 passes. I'm going to do one more pass because it sounds like he still needs a couple more suctioning. I'm going to go clean it out. Do one more time. 1, 2, 3. And then out. I'm going to go ahead and remove these old dressings and then oxygenate, and then I can dispose of this. I would also always make sure to have an obturator and a size smaller trach at the bedside. Again, if my cuff rolled, I would get different gloves so I don't contaminate. I'm going to put water in all of my containers, and then I'm also going to put some hydrogen peroxide in one of the containers. So then I'm going to contaminate this hand. And put this in my hydrogen peroxide. Use my sterile hand and then clean out all the secretions. After it's clean, I'm going to put in my water, clean it all off, and then I will insert it again. And then I can also use like a Q-tip to clean around if there are any secretions around the trach. At this time, I could get new sterile gloves. I'm going to replace the dressing around. And then whenever I'm changing the neck brace, I can have another nurse come in and hold this while I'm changing. So I would get another brace and reattach with a clean one. And just have her hold this in place so it doesn't come out. And just make sure it's secure. I make sure I can fit 2 fingers into the neck brace. And I can oxygenate again just to help. And then after that, I would make sure I document all the procedures I did, the suctioning and the dressing change. I would make sure I reassess his respiratory status to make sure he did have some improvement. And then I would note any secretions or any swelling, redness that was around the trach as well.